We're going to go ahead and get started with our wonderful panel today on youth and crisis response. And I am going to turn it over to Aubrey to introduce the rest of the panel and to get us started. And I will disappear for a little while.
Well, great to have you with us for a second, Carlene. Thanks so much for the introduction. As Carlene said, my name is Aubrey Edwards-Luce. My pronouns are she and her, and I am at First Focus on Children. We're a national nonprofit that works to make children and families the priority in federal legislation and budget policy. And I lead our child welfare and youth justice work. I'm joined today by some amazing panelists, some who are here live with me and some who have pre-recorded some of their remarks. And we've come together today to raise awareness about the dangers that the current crisis response practices pose to young people, youth and children, and how it puts them in danger. And that danger is acute for both BIPOC youth with disabilities, especially those who are part of the LGBTQ community and have experienced homelessness, foster care, or the criminal and youth justice systems. We're here to amplify the voices of lived experts, some of whom you'll hear today, to help guide towards an effective and transformational crisis response. We also want to highlight how some of the pitfalls of our current crisis response can lead to and deepen young BIPOC disabled people's involvement in various systems that youth experience as both punitive, traumatic, and carceral. So we're raising this issue now, today, because the recent launch of the nationwide 988 crisis hotline has provided us an opportunity to examine and reimagine what crisis response looks like for children and youth. So I'm gonna turn it over to some of my fellow panelists who are here with us today. I'm gonna start off with Dennis. Do you wanna introduce yourself?
Thank you so much, Aubrey. My name is Dennis Barrett. I use he, him pronouns, and I'm an advocacy campaign manager at the Trevor Project. The Trevor Project is the world's largest suicide prevention and mental health organization for LGBTQ young people. It's a pleasure to be here today, and I look forward to our conversation, and I will pass it over to Shireen.
Thanks, Dennis. My name is Shireen White. I use pronouns she, her, hers. I'm the Director of Advocacy and Policy at Children's Rights, which is a national nonprofit that uses both strategic advocacy and impact litigation to fight for systemic change in our child welfare, youth justice, immigration, education, and healthcare systems. Thanks so much to the ARC for this important conference, and to my fellow panelists and all of you for joining us today. I look forward to our discussion.
Thanks so much. We have another panelist who's joining us via video, but before we go to our video, I just wanted to also just say thank you to all of the previous speakers that have been on this awesome conference today. And I know that we have folks who have lived experience in these various systems who are here with us. Some of the things that we're going to talk about today, as we hear, especially from some of our lived experts, might trigger some strong emotions. I just want to reemphasize the importance of taking care of yourself as we're delving into this topic. And now I'm going to turn it over to our colleague, Whitney Bunce, who will introduce herself and also kick us off in a discussion about 988.
Hi everyone, my name is Whitney Bunce and I'm a policy analyst at the Center for Law and Social Policy, also known as CLASP. I want to begin by apologizing for not being able to be with you all in person at this beautiful conference. However, I am grateful to be able to join you all by video and provide some background on 988 and how it relates to young people, especially young people in the margins. If you have any questions after my presentation, please feel free to email me at any time. My colleagues will drop my email in the chat. So as many of you may or may not know, 988 was officially launched on July 16, 2022. What this means is that it basically became a 3-digit dialing code to supplement the suicide prevention hotline number and to shorten it and to make it more accessible. However, states had 2 years to, and they still have time. I say 2 years, but they still are able to do these things. However, and they had 2 years from the time that it was passed in 2022, really plan out infrastructure and pass legislation to implement 988 system. As many of you may guessed it, not many states have done that. Still over 24 states need to pass 988 legislation. And so what does that mean? What does that mean that every state has not passed 988 legislation? And what does that mean for the states that have, right? Well, when you think about this, it means that every infrastructure will look different across the board. Some states are building from the ground up. Some states are building from a pre-existing structure, and other states are integrating systems that they currently had with the 988 system. So what does this mean for the people who are trying to use these systems and access these services? In simplest terms, it means every young person who are trying to get access to services will have a different experience across the nation. So someone in Utah will have a different experience than someone in California and in Connecticut and vice versa. An example of this is Connecticut, right? Like before the 988 system was passed into law, and before they passed their legislation, they already had a pre-existing system. They had 211, which served as their call center for crisis services. And then they had a mobile crisis team that will be dispatched if a young person needed them. And then they had all of these other things that pre-existed before 988. And now they're grappling with, how do we now include this new system and not lose the call volume that we once had from this 211 number? And what they're seeing is that how they have done this is that they have just basically included 988 in their 211 infrastructure. While many states might have done the opposite with their pre-existing infrastructure, was made the 988 system the overall system, and then incorporated or integrated their pre-existing system into that. Connecticut has done the opposite. They have kind of made 988 just another pathway for young people to get access to services through their larger infrastructure 211. This is not a bad thing or a good thing, but they feel like this is the best way to move forward, considering that a lot of people still need services and access to services. For another state, this might look very different. They may not even have a youth mobile response team, which is the norm across the country. A lot of states and localities do not have mobile response teams that are specifically related to young people. A lot of people don't have mental health infrastructure that is particularly related to young people, especially when we think about young people on the margins. So what does this mean? How do we move forward? How do we make this system that is supposed to be so transformational, that creates an opportunity to change the way young care? How do we get to these states to where they need to be? There are several things that we need to do. We need to, one, ensure that states are implementing an equitable and racial equitable, accessible, and racial justice focused system. One that understands that every young person have a different experience depending on their identity, their community, and other things. And so for young people to feel safe and to build trust in the system, we need to ensure that these things are in place. Two, we need to really recognize that young people are a distinct population, that they have different needs than an adult does and that a child does, that the young people between the ages of 16 to 25 are a very different age group than someone who has a fully developed brain at the age of 26 or 27, and therefore will need different services and resources. And so we need to create a system that will allow young people to receive the resources that they need. Lastly, I will let Trevor Project talk about this, but really thinking about how do we create services that are specialized, that create representation, that will allow young people to get access to services from people that look and represent their communities. How do we create infrastructure that will allow young people with disabilities to get services that will meet their needs and help them and meet them where they are? These are the things that we need to be thinking about as we think about this 988 system, as we begin to continue, or as we continue to implement it and create infrastructures. We need to be pushing state advocates as well as federal policymakers to do more, not for only for the system, but for young people, to ensure that we really tackle this youth mental health crisis that we are currently experiencing. I am running out of time, but if you have more questions or want to hear more thoughts, please feel free to reach out. Thank you.
Thanks to Whitney for that. And I think Dennis, she kind of teed it up perfectly for you to really share with us a little bit more about the need for 988 to urgently look at the needs for LGBTQ youth.
Yeah, thank you so much for that, Aubrey, and thank you so much for all of that, Whitney. That was very well laid out. And Whitney called out, the fact that we all have different experiences depending on our community, and that's also true for LGBTQ young people. Our research consistently shows that LGBTQ young people are more than 4 times as likely to attempt suicide compared to their peers. And in the Trevor Project's 2022 national survey on LGBTQ youth mental health, we found that nearly half of LGBTQ youth seriously considered attempting suicide in the past year, including more than half of transgender and non-binary youth. Tragically, access to care for these young people is an issue. According to our data, nearly 60% of LGBTQ youth who wanted mental health care in the past year were not able to get it. Where there is no infrastructure for people on the margins like Whitney was talking about, 988 creates an opportunity for young people to receive that mental health care they were not able to get otherwise. But like she said, we must create trust in that system. And one of the ways that we do that is ensuring culturally competent care for our LGBTQ youth and centering those with marginalized identities as we continue to build the system. We see very clear disparities in suicide risk among LGBTQ youth with intersectional identities as well. LGBTQ youth of color report higher rates of suicide risk than their white peers across the board. With 988, our new reality, it represents a significant step forward in transforming our nation's crisis response care system. And it's important that we take up this opportunity to go even further, to meet the needs of our LGBTQ young people and advocate for culturally competent care, regardless if you are calling in Utah, Connecticut, or California.
Yeah, that's so right. Shreen, maybe you can help transition us to hearing from some young people about this.
Of course. Thank you so much, Dennis. And for anyone who hasn't seen the Trevor Project survey on LGBTQ mental health, it is a great resource with a magnitude of information. So I encourage you to check it out. And also, although she joined us by video, I still want to thank Whitney for guidance today on how these services that we're discussing need to be designed so that people's experiences change. Whitney pointed out the need for mobile crisis response services that are equitable, accessible, and racially just. And that theme is going to carry throughout our presentation. I'm really excited for you to hear from 2 young people who bravely speak about their own experiences as lived experts and as advocates, and the need for services that are uniquely developed in accordance with the needs of young people. So I'm going to turn it over to some pre-recorded videos from Smitha and Kayla.
My name is Smitha Gundavajala. I use she, her pronouns. I'm a change maker with the New Deal for Youth project being led by the Center for Law and Social Policy. I have been a mental health advocate working with young people to advocate around their experiences with their mental health and also to address gaps in resources and the lack of services tailored to young people. I think that what young people that I've worked with and that I would need from mental health services are primarily services that are culturally responsive and equity informed. Equity informed services are really important because they account for the unique barriers that people may face based on language, race, culture, or other aspects of identity. I think that culturally responsive services are also important, and that requires having diverse providers. So I would want to see maybe more recruitment and workforce development for professionals of color, and also training providers to acknowledge the impacts of those societal structures on people. I think in my own experience, I really would have liked to have my mental health services follow the disability model, which acknowledges that mental health challenges are not individual deficits, but often a response to societal systems and structures that might be causing harm. And so that's something that I would have appreciated, because it took me a while to understand that what was happening around me was impacting me rather than that I was struggling or failing in some way. And then thinking about access for young people, I think it's important to have shorter waiting times. Young people who want to seek help in the moment may not follow up later, and the initial feeling or moment of need may pass and they may not follow up. And thus they might fall through the cracks and not get the services that they actually need. I think it's also important for these services to be located where young people are, because young people often don't have that much privacy. So having them located where they go to school or at a community-based organization, somewhere in their usual path, rather than having it be in a hospital system or somewhere where they might be dependent on their parents for transportation and then have to explain why they're getting services. And then I think the last thing that would be really important to have in mental health services is for them to be decoupled from law enforcement and carceral systems, so that you can reduce the stigma around seeking mental health treatment and also allay some of young people's fears around reaching out for help. I did not personally interact with law enforcement, but in my role working with young people, there was an incident that resulted in law enforcement responding to a young person's mental health crisis. I was working with a group of young people, educating them around substance use and mental health. And so one of the young people in that cohort came to me because he'd gotten a letter from one of his friends expressing thoughts around suicide. And he didn't know the urgency of the situation and was really concerned. And we didn't know either, so we weren't sure quite how to respond. But as mandated reporters, we were almost obligated to call law enforcement. And so ultimately, after consulting with my supervisors and their supervisors, that's what we decided to do. But that ended up being one of the worst things that we could have done. Law enforcement, their response was sudden, invasive, not necessarily warranted in that situation, because it turned out that the young person had actually just been expressing themselves to their friend, and that those feelings and thoughts were not immediately urgent and they weren't planning to act on them. And furthermore, that young person was undocumented and his parents did not speak English. And the law enforcement officer that responded and showed up at their house did not speak Spanish. So the parents were very concerned for their safety, confused about what was happening. The young person also had not expressed to his parents how he was feeling. And so they just were not sure what was going on. And the young person was put into 5150 72-hour mental health hold, which was not appropriate for the situation because, like I said, the young person was not like immediately or urgently planning to act on some of the feelings and thoughts in that letter. And ultimately, calling law enforcement resulted in a loss of trust in us and in his friends for confiding in us. So I think that if we were not required to report to law enforcement, and if we were maybe trained or empowered on suicide prevention strategies that really centered dialogue, then we might be able to respond in a different way. But unfortunately, our system really involves and centers law enforcement response, and that's not always appropriate.
That was Smitha. We're going to transition to the next video from Kayla.
My name is Kayla Muskis. I'm a native Texan, born in Brownsville, raised in Los Fresnos. Spent a lot of time as a kid growing up in those small border towns. I'm now currently living in San Antonio, Texas. I moved here for better educational opportunities. And as a 25-year-old disabled college student, it has been a ride. I have disabilities that require a lot of attention and time. ADHD, dyslexia, PTSD, Hashimoto's, thyroiditis, anxiety. Many of those things impede my day-to-day functioning, and having to take medication and be on top of doctors and have a schedule for school is not easy for anyone to manage. So I take a lot of pride in what I've accomplished and how far I've come in my personal life and goals. But lately, I can't stop thinking about mental health in general. And I see this stigma. I know as much in my culture, and I'm sure many others, that there's this shame and we feel like we're being judged because our kid needs a little bit more than we can provide or know how to provide. The capacity of our consideration for children in general needs to start changing. This attitude we have towards mental illness and the approaches that we take right now are not giving us the outcomes that we're going to be satisfied with. Many rural areas like Uvalde and the Rio Grande Valley, these small towns, don't get a lot of resources. I'm not going to put my hope or faith in a government that I was raised by in the foster care system that did nothing but neglect me. Even coming from like a foster care demographic and aspect of things, maybe they did have an encounter with this type of help and it wasn't, it further divided their family instead of actually helping. So with that experience, we have to make sure that we're taking that history into consideration and changing the relationship of authority. Why is authority so intimidating? To better improve this emergency hotline to become an actual sustainable, reliable option for people to take. And I hope that in doing that, we can change the relationship we have with authority and our community as a whole.
I'm so thankful to both Kayla and Smitha for sharing their perspectives and their wisdom with us. And so much of what they shared really resonated and reminded me of some of the experience in my prior career. Before I was a policy advocate at the federal level, I worked as a guardian ad litem attorney for children in the foster care system in DC, some of which also had contact with the youth court system as well. And I'm not sure if all of the people in our audience today, there are many of you, 100, thanks for being here, know that there's about 420,000 kids who are in foster care any given day. That each year there is close to 80,000 years who are in the youth detention and like postage education system as well. Each year there are close to 700,000 kids who are in foster care, and Black and Indigenous and LGBTQ youth, as well as youth who have disabilities, are overrepresented in foster care. So that's why we're going to spend some of our time going forward talking about the intersections of these systems, and how the mobile crisis response leads to the systems, and how the systems can increase risk in the mobile crisis response. But it's really important to also know that while we don't have national data available, studies suggest that 24% of youth who are in the foster care system have special health needs, and 13% have been identified as emotionally disturbed, and close to a third of the youth who are in the youth justice system have been identified as having a learning disability or some other type of disability that could be served by the IDEA. So this is a very prevalent issue for kids in the foster care system. That's something that I witnessed as well. The jurisdiction where I was working had a youth mobile crisis response specifically for youth who are in the foster care system. And what I saw repeatedly was when youth were actually, when caregivers called mobile crisis response, there were oftentimes really long delays. And some of our experts talked about that, the need to be reliable and timely. Oftentimes the needs of the youth were not centered in the same way as the needs and the dysregulation that was being experienced by the adults, by the caregivers, by the parents. And the child's needs were kind of put second under that. There was also this punitive versus supportive type of response. Many of the responses were experienced as being very punitive, like it's trying to force the child away from a home where maybe they were having some stability, or they weren't having stability, they were experiencing unsafe things in that home, and were being penalized, feeling like they're taken away from their family, or being isolated or kind of focused on as the problem, as opposed to being supported. And just generally speaking, it was just traumatic. It was a traumatic response. There was a lot of needs that were created by the response that those young people that I worked with experienced. So, I think that's why it's important for us to talk about this intersection, specifically for BIPOC youth with disabilities, and the intersection specifically for children, right? One of the things that we know is that children of color, specifically Black children, are adultified, seen as young as age 7, is seen as over 4 years older than how old they actually are. And so there's this assumption of malice that wouldn't get put on children who are of a different race. There's assumption of danger and risk. And so instead of kind of approaching those kids and treating those kids as kids, oftentimes when kids are in those crisis situations, they are oftentimes met as being a threat instead. And that can really be dangerous when they're being responded to by law enforcement and other authority figures. So that's one of the things that we see, and it's not only in the mobile crisis response, right? We also see this in our school systems where Black and Latino and Native American children face higher rates of disciplinary punitive actions like expulsions and suspensions more frequently. And we know that this is also a reality that is experienced by youth in the LGBTQ community as well, where their behaviors or their symptomology is interpreted as being aggression and threats, and oftentimes are overlooked. Their disabilities are overlooked. So, we really want to draw attention to the fact that our system, especially our mobile crisis system, has to consider how the needs of youth are different from BIPOC adults and adults with disabilities. there are considerations that need to be made, and our experts, Kayla and Smitha, talked about that today as well, that we have to think about the consent and the agency, right? With the young man that Smitha talked about, how he hadn't spoken to his parents yet about how he was feeling, and so how much information is being disclosed in that moment. The whole issue of privacy comes up as well. And if he wanted to access some services, would he be able to do that given his age and the requirements for adult consent as well? Both of our experts brought up the point of needing to really focus on cultural responsiveness and cultural humility, and how important that is from all aspects of youth's identity, especially youth who are at these intersections. Also, the accessibility of services is something that have to be considered as well. So while there are accessibility issues with regards to disability, when you're also talking to young people, youth who may not have fully developed frontal lobes yet, or might have some other types of disabilities, that has to be taken into consideration, making sure that they understand what's being put before them, the response that's being provided for them, options that are being put before them as well. And then there's also need for us to have special considerations around the needs of LGBTQ youth. And I'll turn it over to Dennis to talk more about that, as he's our expert there.
Yeah, thank you, Aubrey. So yeah, our research, just shows that LGBTQ young people between the ages of 13 and 17 report higher rates of considering and attempting suicide in the past year than young people between the ages of 18 and 24. This association is found consistently across our research on LGBTQ youth mental health, and that's especially true for those with disabilities. For LGBTQ youth who've ever been diagnosed with autism, they had over 50% greater odds of attempting suicide in the past year, and deaf and hard of hearing LGBTQ youth reported significantly higher odds of considering or attempting suicide in the last year as well. So when you sort of compound a lot of those things that Aubrey was already talking about on top of, living under a purview of parents or caregivers that may not be LGBTQ affirming, being financially dependent on adults, parents, and caregivers, and having to attend, a school environment where they are subject to bullying, discrimination, and social rejection from peers, there's just, again, that intersectionality of those issues that are sort of compounding on one another that would necessitate sort of, those specialized services for this community. And more broadly, the current generation of young people is faced with unique challenges compared to previous generations as well, which may play a factor in higher rates of mental health issues. In the world today, LGBTQ youth have greater exposure to negative news events and information because of the internet, and they're also just growing up amid a really tough time in our global and political environment that's filled with nonstop crises and instability. So ensuring that that we are meeting their specific needs, that differs from other folks, BIPOC and LGBTQ and people with disabilities, they need these specialized services. So it's so important that we have 988 and that these programs start to get built and center these communities.
Yeah, absolutely. And we also need to think about how failure to do that can really make it more likely for youth to experience disproportionate harm in the variety of systems that are often connected to mobile crisis. Maybe Shireen, you can lead us in a bit of a discussion about that.
Yeah, I think that's a really common and continuous theme that you've already heard and you'll continue to hear throughout this presentation. And that is, if we aren't thinking carefully about mobile crisis services and the individuals who will utilize those services, then we run the risk of creating more trauma and more harm. And I don't think that's what anybody wants to do. So we want to take a moment to really draw your attention to the ways that mobile crisis has been an on-ramp to other systems that disproportionately harm BIPOC youth with disabilities, and make sure groups of young people are not being left out of this conversation as these services are being developed and 988 is being implemented. So I want to start with the child welfare system, which is also known as the family regulation system. So take a moment and think about crisis responders who are answering calls to 988. Most of those responders, if not all, will be mandated reporters under state laws, which means that they're required to make calls into Child Protective Services or CPS if they think that a child is being harmed or there's some concern for neglect or abuse. And this call might trigger increased surveillance by CPS or Child Protective Services for both young people and for their families. And so as we think about creating and designing these mobile crisis services, we should be asking ourselves, is there a way to initiate policies or practices that don't result in unintended consequences, that don't result in increased surveillance for children and families, and perhaps unnecessary involvement of the family regulation system, which is not equipped to deliver mental health services or supports for young people. And just taking this a step further, we want you all to know that children and parents who are BIPOC or who have a disability or who are BIPOC and have a disability, and all of the intersections that we've been talking about today, statistically, they face greater rates of removal by Child Protective Services. So there's the phone call that could happen by responders. And if young people and their families identify in any of these categories, then know that they are at greater risk of family separation. So this is a real opportunity for us to be proactive about the way that crisis response interacts with CPS involvement. I also want to talk, you've heard our lived experts and Aubrey and Whitney talk about law enforcement. And I just want to talk about sort of the interplay between law enforcement and child welfare and make sure that is also on everyone's radar. Often when child welfare agencies investigate families, especially families of color, and also families and young people with disabilities, they do so in conjunction with law enforcement. And in the child welfare system, we've seen this unfold in a way that causes more trauma to families. And we don't want to replicate this harm in other systems. We don't want to replicate this experience for children and families who are looking to get mental health supports through 988 and other mobile crisis response services. In addition to the child welfare system, I want to talk about the juvenile legal system, and I think Aubrey will have some to add here as well. So there's a lot of crossover between the child welfare system and the juvenile legal system or criminal youth justice system. And when, for kids who are already system involved, when their caregivers and young people seek mental health services, we have to be mindful that the use of law enforcement to deliver these services could lead young people down a path of unnecessary, punitive system involvement, and it could lead them away from their community placements and into more restrictive institutional placements. And maybe Aubrey, you can share more about this pipeline into the juvenile legal system or into institutional placements, which are placements that are disproportionately used for BIPOC young people with disabilities.
Yeah, exactly. So when young people with disability, BIPOC young people with disabilities, do receive mobile crisis responses that involve law enforcement, remember again, like I was saying, the adultification of young people of color puts them at an increased risk of receiving a punitive type of response, right? So less likely to get a response that is going to lead them towards more community-based health and health services, more likely to receive responses that will lead them to being put in like institutional settings or congregate settings away from their family. And unfortunately as well, when they are young people who are in those settings, oftentimes they're not getting access to screenings that will help identify those disabilities. Like sometimes those disabilities aren't even identified, right, when the mobile crisis response team is being held. So then they're in a system where they're less likely to get that. They're also less likely to have access to services that would help them manage and heal from whichever crisis they're experiencing. they're also less likely to have access to other services that will help them stabilize and be ready to continue on their development to adulthood, right? So less likely to get educational help in general, just less likely to be able to have access to their education. So there are these consequences of becoming youth justice system involved as a result of a mobile crisis that actually makes them more likely to end up experiencing criminal justice system involvement as an adult. So this is how the pipeline works. It's cyclical and almost like a downward spiral that leads specifically BIPOC young people with disabilities into a higher risk of being criminal justice system involved.
Yeah, and I know there's a question in the chat, so thanks, Lindsay, for that. And we'll circle back to that at the end. And people can please feel free to add in more questions that we can get to at the end of the presentation. Thanks for sort of deepening our understanding of those aspects. Aubrey, I wanted to raise another sort of group of people that we should be thinking about in designing these mobile crisis services. And that is those people that have already been harmed by punitive responses when they are in crisis, right? They've experienced restraints or over medication or loss of agency, just to name a few examples. And in speaking with people who've been impacted in this way, they've shared a real hesitancy to seek out crisis response in the future for both themselves and also for those who are older, for their children. And so we want to just point out it's super important to understand and account for these experiences that people have already had when we're designing these current and future services that people will want to access.
Yeah, and I
I
really appreciated that both Smitha and Kayla kind of spoke to this like historical piece of it and like acknowledging both the family's historical experiences with mobile crisis response as well as their community, whichever community they're part of, that long history of interaction either with law enforcement or mobile crisis response, because you can be more likely to engage in systems that might actually have a pathway to something that's more helpful if you have, a traumatic history with that system. So I really appreciated that they brought that up. And maybe Dennis, you can help us think through like what are some of those ways that we can think about how to address those historical trauma and in the LGBTQ community for youth, and how to create specialized services and that need in the community.
Yeah, I just wanted to reiterate, what you all said again. It's very clear that our welfare systems and our systems involving young people require transformation. Like that is extremely clear in terms of the cyclical nature of things. And and when you look at research, again, 20% of LGBTQ youth report experiencing homelessness or having housing instability. That's especially true for Native and Indigenous LGBTQ youth and trans and non-binary youth. They experience homelessness or housing instability at some point in their lives. That's associated with 2 to 4 times of the odds of considering or attempting suicide. Not only are they subject to attempting suicide and suicide ideation, but people who are unhoused are often, have higher interactions with law enforcement. We just sort of talked about what that means for people with who are experiencing a crisis or a person with a disability. Youth of color are also LGBTQ youth of color are also reported higher rates of being in foster care compared to their white peers. So again, we're talking about, those communities that are more subject to, the harms that these systems put on them and the punitive systems that are being put on them. Mental health challenges are not a one size fits all, and neither are those solutions. This is especially true for groups who are placed at disproportionate risk of mental health challenges, such as LGBTQ young people and young young BIPOC people with disabilities. And I really just wanted to touch on again, this conversation about law enforcement. We heard a really powerful story earlier from Smitha about the harms that law enforcement and our criminal legal system have on disabled communities. People, and this was a shocking statistic when I found this, but people with untreated mental illness are 16 times more likely to be killed by law enforcement, which is just absolutely astounding. And when you put that on top of what Aubrey was talking about in terms of the adultification of Black people, and especially when we're talking about the adultification of Black trans people. She also mentioned, the underdiagnosis of mental health disabilities and mental health illnesses across the board. And we know that cisgendered white men are the ones who are likely to be more diagnosed than any other demographic, especially amongst LGBTQ youth and LGBTQ youth of color. While I don't have, again, that data that's broken down in terms of what's 16 times more likely for Black and people of color and LGBTQ people, but what we know anecdotally, what we know about systems of oppression is that number is more than 16 times for those communities. 988 has that potential to bring that transformative care to BIPOC and LGBTQ youth by providing an option that does not involve law enforcement and builds that trust. We're hopeful that we can get there. At this moment, we have an incredible opportunity to develop and integrate specialized services as part of 988 to serve marginalized communities, including LGBTQ youth and youth with disabilities. The Trevor Project we are trying our darndest and are actively engaged with our partners at HHS, SAMHSA, and Vibrant to ensure there is an integration of our best-in-class crisis services to 988 and have contacts from LGBTQ youth redirected, hopefully, to our own counselors who are specifically trained to serve the unique needs of LGBTQ youth in crisis. We're also working with the Lifeline to train their counselors as well on competencies around LGBTQ youth who identify as LGBTQ. And we are hopeful that we will have some really wonderful news to share on this front really, really soon.
Thank you so much, Dennis, for that. And I love ending on just that note of hope that, what we've shared are some past experiences and what young people need to receive from the mobile crisis response services that are in place. And also just some things for people who are developing these services and working in community to really think about as these services are being developed, keeping young people in mind, keeping the needs of individuals, keeping the need of BIPOC youth with disabilities in mind as these services are being designed, and also working directly with them and being led by them. I mean, these young people can tell you exactly what they need and how to deliver those needs. So we hope that you will take some notes from this conversation and move it forward in your work and implementation. We have some time for questions, and I can start with, I know there was a question from, I'm just scrolling back up. It was in the chat, but feel free to put your questions in the Q&A. This was from Lindsay. What alternatives might there be to calling CPS when you are a mandated reporter, say an educator in the public school system? What alternatives might we imagine to disrupt that system that disproportionately negatively impacts marginalized youth and families, but also make sure that children are safe? That's a huge question, Lindsay, and there are so many conversations right now about mandated reporting and changes to the policy. And I would say that I think it's an opportunity to think about legislative change in your state. Are there ways to narrow, right? I could go on and on about when this regime was started, right? It was for child abuse. And so are we reporting for things that don't necessarily require a report into CPS, but might just require helping a family, right? We wrote an article about the ways in which mandated reporting has sort of moved people away who are in the helping profession away from actually helping. And so if we can stop and think, like, is there a way to help this family without calling or needing to involve CPS and actually provide the help needed? And so when we think about the mobile crisis response services, right? Can't those mobile crisis response services be the help that people in mental health crisis needs, as opposed to CPS who are not trained or don't specialize in helping people. So I think there's some legislative things, and I think that it's really calling on people to think about whether a report needs to be made. And this is a good opportunity to start having those conversations. We've seen in some school districts, you mentioned educators, but pilot programs for educators before making the call to huddle a team of professionals and community people and like lived experts to say, hey, is there a way that we could resource or help handle this situation that won't require CPS involvement or increased surveillance for the family with another system that they distrust and that hasn't proven to be necessarily helpful in the past. I know Aubrey or anybody else have anything to add on that particular question?
I would echo a lot of what you were saying. I mean, I think the lawyer in me wants to say, we are not advising you legally to not follow your your state laws. We don't want to be responsible for that. We don't want to make you responsible for that. But I think that there is definitely an opportunity and a need to have a conversation about the ways in which we can respond to crises. And I think there is a need to also this is like a bigger conversation, right? I have family members who are pediatricians, and this is a thing that comes up during our Thanksgiving conversations. As somebody who works in child welfare, is like having to be a mandated reporter and making those calls, and there are kids in their hands. They don't want anything bad to happen, and they think like this is the way in which I can make sure that kids are safe. But unfortunately, what we know is that very frequently, especially when these are kids who are BIPOC and part of the LGBTQ community and disabled, they are oftentimes not safer. Kids who are in foster care, who are part of those marginalized identities, as Whitney called them, they are oftentimes more likely to be abused in foster care when they get there. So there are a lot of considerations that have to be made. I'd also encourage a conversation with your child welfare agency and say, because a lot of child welfare agencies right now don't have foster homes available. So these kids are ending up in institutions and group settings. Have a conversation with them about, what is it that you can do, and who would be better equipped to fill the gaps of your capacity, and to start having those conversations across some of those silos, right? That would be some of the first steps I'd recommend.
Thanks, Aubrey. Thanks for having my back on the legal front too. I see there's there was one question to Dennis, and Dennis answered that about the Trevor Project. I think you, thanks, Dennis.
Yes,
And
you can just shoot me an email.
Perfect.
Can I take this last question from Katie real quick?
Yeah, I don't even see it. You want to read it and take it?
Sure. Katie such, and I'm sorry if I messed up the last name. She said, how do we start being proactive to identify crisis before it gets to CPS point? I think that is so important. I mean, I think that's another way in which looking at some of that legislation, looking at community supports, we kind of call this like before the front door, before the crisis happens. How can we make sure that we're supporting families who know that their children might have some needs that they don't feel equipped to meet right now? How can we help to get those resources and that education to families before it becomes a crisis? And also just something to think about too is the trauma of removal for kids into foster care is oftentimes also part of what can drive them to a crisis. And I think Smith had talked about that, about how sometimes the harm that they're experiencing in the community is part of what is leading to the mental health crisis for young people. So the more that we can think about ways in which to intervene before CPS is called or the law enforcement's called, the better we're going to be able to make sure that young people are getting their needs met with their families and with their communities.
Thank you, everybody. This was a wonderful and very informative presentation, and I'm so glad that we had all of you to bring the perspective of youth to this conversation on crisis response, and to bring youth into the conversation directly. Really appreciated those videos, and Whitney, of course, for speaking with us via video at the beginning. And I will ask our speakers to go into the main lobby because I see that there are still some questions coming in. And if you go into the main lobby, you'll still be able to interact with people and be able to answer some of those questions. And we're going to move on to our solutions panel in just a little bit. I do need a bit of a break though. I know we're running behind today, but I think I need at least a 5-minute break between this session and our next. And remember, you can also watch us on YouTube. We're live streaming. But thank you so much. And we look forward to continuing this work together on transforming crisis response. I think we've heard that we all pretty much have a role, no matter who you're representing in this world. So, all right, we'll see you in the lobby and in the next session.
Thanks, Carlene.